This is our patient, female, 16 years, unmarried, and here I am showing you two structures. One is the urinary bladder in transverse section, and this oval structure is the right ovary, and the right ovary is studded with developing follicles of variable sizes 1, 2, 3, 4, 5, 6, 7. Now they are all arranged around the periphery, and there is a stroma also seen within it. Now this is suggestive of polycystic right ovary. This is the right ovary, and this is the urinary bladder. So this is the right ovary, and here comes where is the left ovary. Okay, let's study some other phenomena in the meanwhile in this young I have magnified to show you that the ovary is polycystic, and this is the full view. Now you see that this is the ovary, and this is the stroma between. You can see the number of developing follicles within it. This is the urinary bladder, and these are all follicles that are arranged at the periphery of this right ovary, with the largest one seen measuring 8.9 mm. So this is so far the status of the right ovary is concerned. Transverse section of the ovary. Now, what else? So now this is the, I'm going to show you the uterus. This is the uterus. Measures 5.4 by 2.1, is relatively hypoplastic in this view, but the view is not proper, you know. That is the reason why the view is not proper. I'm going to explain you. First of all, let us see the left ovary now as it's in view. This is the left ovary, and again you can see that there are follicles seen arranged all around the periphery of this left ovary. This is the urinary bladder. This is the magnified view. So both ovaries are polycystic. This is the finding number one. Further, what's the other finding? So now in this view we can see the both ovaries together. Here, this is the right one, this is the left. Now, this is the uterus, okay? This is the transverse section of the uterus. Now what you see is that this is the body of the uterus on the left side of your city, and this is the second body of the uterus. The question is whether it is a septate uterus or this is the uterine body number 1 and this is the uterine body number 2. So now this finding is somewhat what we have to rule out is that whether it is we are studying a case of septate uterus with 2 separate bodies, uterine bodies and endometrial canal. See, in this view you will see that this is the uterine uterus. This uterine body measures 4.4 into 2.2. This uterine body measures 5.0 by 2.0. So the size of both the uterine bodies is relatively less as compared to that of the normal. Now in the same patient you will see that this is the endometrial canal in proliferative phase, pre-proliferative phase in this side of the uterine body, and now on the right side this is the endometrial canal. So on the right side and left side 2 endometrial canals are seen. How do we differentiate it from septate uterus or uterine DIDDEILPHUS? Now we will have to see the cervix. Is there one cervix? Now this is now I have aligned the uterus with the vagina, and you can see that this is the cervix, this is the vagina, this is cervix number 1, and now you see there are 2 cervixes. This is cervix number 1 on the right side, this is cervix number 2 on the left side, thus suggestive of the fact that we are seeing uterine DIDDEILPHUS. So this is the urinary bladder. So, in fact, we are now studying the uterine DIDDEILPHUS, and with 2 cervixes that I have shown you, with 1 uterus. This is the uterus number 1, and then this is uterus number 1. This is the uterus number 2. So both have their own cervixes. See. Now you will get the proper length of the uterus. It is 6.4 because we have to include the cervix, and this is the cervix of the uterus on the left side. So this is measuring 6.4 into 2.0, though the length is less as in anterior posterior diameter, and this is the uterus on the uterine body on the right side of your screen. Now if you measure this with the cervix, 7.8 by 2.20, so both of them have are reduced in size in anterior-posterior diameter. The length is fine. This is the cervix and this is the endometrial canal. Sorry, I have taken both cervices together. Let me take the single cervix. This is the full view of the right uterus on the right side, measuring 6.6 by 2.2 centimeters, and this is the vagina. This is the cervix of this uterus, and this is the uterus on the right side in longitudinal section, and this is the cervical. This is the endometrial canal in early proliferative phase. This is the urinary bladder. Okay, now once I will go towards the left side uterus and try to get its length again with its cervix. Now this is the initial measurement that I took was not correct. Now this is the cervix of this uterus on that, the uterus on the left side, and this is the cervix of the uterus on the right side. Now this is the cervix of the uterus on the right side, on the left side. This is the cervix. Okay, this is the uterus. This is the uterine body. This is the urinary bladder. And this is the cervix of the second cervix, right side. So this is cervix left, and this is the uterus on the left side. So we have studied a case of uterine DIDDEILPHUS having two cervixes. They have their own cervixes, and this is a case of uterine DIDDEILPHUS with bilateral polycystic ovaries and reduced size or small size of both uterine bodies in anterior-posterior diameter. Okay, left side, right side. Because these two cervixes are together, that's why the cervix appears to be bulky. Now let's measure it again. This is the uterus, urinary bladder. This is the uterus on the left side, this one. This is the uterus on the right side, this area. This is the cervix of the right uterus. This is the cervix of the left uterus. And this is the endometrial lining, central clear, proliferative phase. This is the endometrial canal on the left side, central clear, no myometrial mass. Now the uterine DIDDEILPHUS with two cervices, two uterus, both having their own cervices, and both having the size of both the uterine body in anterior-posterior diameter is relatively small compared to the what should be the normal. This is the endometrial canal. Sorry, I mislabeled. And this again 7. Right-sided uterus measures 7.4, including the cervix, and the left-sided uterus measures 7.4 in length, including the cervix. The right-sided uterus measures 2.2 centimeter in anterior-posterior diameter, and the left-sided uterus also measures 2.2 centimeter in anterior-posterior diameter. Now we are seeing this in longitudinal section. This is the right one. This is the left uterus. Sorry. So this is a case of uterine DIDDEILPHUS with relatively small size of the uterus in anterior-posterior diameter with polycystic, bilateral polycystic ovaries. Thank you very much. Now it's very important to see that whether it's if it is a DIDDEILPHUS uterus, if we are dealing with the case of DIDDEILPHUS uterus, then are there two vagina as well? You see, this is the vagina for the uterus on the right side, and when I go downwards, this is the vagina for the left-sided uterus. So two vagina, two cervixes, two uterine bodies, two separate uterus, two vagina. Again, favoring our diagnosis of DIDDEILPHUS uterus with bilateral polycystic ovaries. Thank you very much. Now remember that whenever there is one anatomical normally seen, then see for so many other. As for example, in the same patient, now I am trying to see this is the gallbladder portal vein liver, and I see that I am trying to see the right kidney, and there is no right kidney seen in the right lumbar location. Lamba sans beta, lamba sans. Straight away you will see the iliopsoas muscle. This is lilosans. This is the liver. This is the right diaphragm. This is the iliopsoas muscle, and the right kidney is absent from the right lumbar location. Beta pe sans lo se roko, right kidney not seen. सीधे हो जा बेटा, मेरी तरफ करवटी हो. And I did not see the right kidney in any other ectopic location, so it's absent congenitally. Now you see that this is the left kidney, and the left kidney is normal by all parameters. However, measures 12.0 centimeter in length, normal is up to 11, and measures 4.8 centimeter in anterior-posterior diameter, and its length is slightly more than expected normal, which is not unusual in cases of having absence of one kidney. And this is this kidney is compensating for the right one, so this is an additional finding in this patient. Thank you very much.